Welcome to the Saving Lives podcast. I'm Eddie Joe. Today we're going to be discussing continuous blood glucose monitoring using a little device such as this one, which I recently got my hands on. More about that later, versus the conventional fingerstick approach to obtaining, blood glucose levels in patients. The article that we're going to be discussing was published in the Journal of Critical Care on August 5th of 2024, and it is titled Continuous Glucose Monitoring versus Conventional Glucose Monitoring in the ICU, a randomized controlled trial. Hat tip to the authors, definitely read these data for yourself and do not trust me. And of course, quick plug for my book, the Vasopressor Inotrope Handbook. You can purchase it on Amazon, or if you purchase it directly through me on my Shopify account, then you can save 10% by using the code podcast on it. So there's that. Let's go ahead and get started on this article. Well, first of all, we check blood sugar on patients because glycemic control is important for a number of things because, at the end of the day, both hyperglycemia as well as hypoglycemia are associated with increased morbidity and mortality in our patients. For example, in the cardiothoracic ICU, it's associated with infections in the actual wound itself. So we try to maintain the patient's blood glucose levels within a certain target. Depending on your patient population, if you are a medicine resident, check out the NICE Sugar Trial published in the New England Journal of Medicine. It's definitely an oldie but goodie. So doing the conventional point of care blood glucose monitoring is labor intensive. You need to have somebody from your staff go and check the patient, check their finger. It is painful for the patient because they have to get pricked. They have to get woken up a lot of times if you check it in the middle of the night. And, it's just a lot of resources. Now, there is the advent of these again, the continuous blood glucose monitoring, which, by the way, I'm not a diabetic. I'm just running a science experiment with myself. But this gives you some cool data, and hat tip to the person who helped me. You know who you are, who helped me obtain one of these. But like, for example, right now, my blood glucose is 83, and you can see what my trend was like during the day. I just finished having dinner, by the way. No blood glucose spike. But nonetheless, this would be pretty cool because like that, we could catch the patient's hyperglycemia and hypoglycemia earlier and improve outcomes, right? That's what we would hope. So what these authors did is that they randomized 96 patients in an ICU in the 4th affiliated hospital of Chu University in China. Pardon me if I mispronounced that. And these patients had either diabetes or stress-induced hyperglycemia. So the patients were either randomized to keep on getting the finger sticks or to have the continuous blood glucose monitoring system, in place. Now, one of the caveats of the study is that they were just checking the finger sticks every 6 hours versus in our ICUs, for certain patients on insulin drips and things of that nature, it's usually every 1 hour. The other gripe for this study, and again, a hat tip to the authors because they did something that I haven't done, is that they were looking at 28-day mortality as a primary outcome. Now, I will say that even though blood glucose is extremely important, I don't think enrolling 96 patients in total is going to be appropriately powered for, it's going to be appropriately powered for a mortality benefit. In which case, the secondary outcomes are a little bit more valid, and those include the ICU and hospital mortality, which, isn't valid, but length of stay, and they also looked at glycemic variability metrics, as well as the incidence of either hypo or hyperglycemia. So all things that are important for our critically ill patients. So they went ahead and randomized these patients between those two arms. And again, the first primary outcome was 28-day mortality. As you could assume, and as well as anyone could assume, there was no difference between the two groups. Okay, there's a difference in percentages, but in reality, that's not statistically significant. Now, when it came to the glycemic control, this is where we found some benefits for using the continuous blood glucose monitoring system, where they had significantly reduced mean glucose levels, and they also had reduced time-weighted average glucose, as well as glucose variability compared to doing the finger sticks. And all these were statistically significant. In addition, the time that the patient was in the blood glucose range that the clinicians were trying to achieve was higher in the patients that had the continuous monitoring versus the point of care, and this was at 64.5% versus 46% for the finger stick. So they were in the range and the target that they were trying to hit more often. As well as having the continuous blood glucose monitoring also reduced the percentage of time in hyperglycemia. And that's because these little devices will alarm you. And I don't know how they worked in these particular institutions in China, but they will notify you if the patient does go above their targeted threshold that one sets. And at that case, I guess there'll be more interventions on these patients. They'll get more insulin and or they'll get their D5 turned off if that's something they did. I don't know. I'm just making it up. So that all makes sense. Now, when it comes to hypoglycemia, in other words, the time that the patient spent with their blood glucose below their threshold, there was no difference between the two groups. So that was interesting finding. Now, with regards to the length of stay, this was not statistically significant. There was no difference between the two groups for either hospital or ICU length of stay. So all these are pretty interesting findings of this particular technology that is hopefully going to become more inexpensive. And the caveat is not necessarily the caveat, but the thing to think about is that even though some people will say that this is a negative study because it has no difference in mortality, the reality is that we can't really expect it to have a difference in mortality. There are other morbidity benefits to it. Having high blood glucose has been demonstrated to have increasing effects on infections, or in other words, patients get more infections. But there are some issues with these blood glucose monitoring systems that these authors pointed out. First of all, they said that they might be inaccurate at times, that they might not work in patients with poor perfusion, which are a lot of our ICU patients. That's why they come and visit us. And they also might need frequent calibration. Now, I don't know which ones they used, nor am I an expert on the matter outside of recently a user, but I think after 15 days, I'm done with this thing. But one of the main things is the cost of these devices. Now, at the same time, we have to think about the human cost of doing the point of care blood glucose monitoring in our patients. Anyway, that's a quick little podcast for today on using the continuous blood glucose monitoring on critically ill patients versus the point of care. I really would like to know what you guys think. Is this something that you'd be interested in bringing on into your ICU to make sure that your patients have an adequate blood glucose target? I don't know. I think it's pretty fascinating. I have found it now that I've been wearing this for about 3 days. It's been a very interesting thing to discuss with my patients who are diabetic with regards to them being a little bit more proactive with watching how what they eat spikes up their blood glucose levels. That has piqued some interest and has actually encouraged some of my patients who, again, are seeing me with it on my arm to inquire about what they could do, especially after cardiac surgery, where their diabetes contributed to their coronary artery disease. They're definitely interested in seeing how they could take better care of themselves so that they don't need to see me again in the ICU for another cabbage because, well, those don't happen twice. I mean, they could, but you guys know what I mean. Nonetheless, I greatly appreciate you guys hanging out with me today and checking out my podcast. Thank you for your support. If you're watching this on YouTube, hit the thumbs up button and subscribe for more content. Hope you guys have a great day. Bye.